So at my job at the hospital as a physical therapist, I work with a lot of people who have traumatic spine fractures, whether it be a burst fracture or other type of fracture. I work with them. And a lot of times they don't necessarily need a surgery, or the neurosurgeon wants to see if it is able to heal itself if it's mildly displaced. If it's an unstable fracture and on a load-bearing surface, then a lot of times they will want to repair it. But if it is in a spot where it can heal naturally, they're going to try to allow it to do that. But with that being said, oftentimes I will see TLSO braces being ordered, or these are called orthoses, so a spinal orthosis. And so essentially what these are used for is to, at least the general consensus is that it has been to stabilize the spine so that it is not moving as much, and so that the bone has time to lay down new bone and heal in that area. But it's interesting because newer research over the past 3 or 4 years has shown that it doesn't really matter if that is worn or not. Most people end up taking it off anyways. It can be used for pain control in the beginning, but oftentimes people just end up taking it off because it restricts their motion. It doesn't really help with the pain all that much. Sometimes it can make the pain worse depending on the person. So it really is dependent on, again, it's a person by person basis. And so yes, if the order is in by your neurosurgeon, follow that. But the evidence from what I have seen from from one systematic review that I read, and then looking at some of the primary sources that they used in their systematic review, all leads to, for traumatic spinal fractures in like the thoracic and lumbar spine that aren't causing like really severe neurological deficits, you don't really need a spinal brace unless it is for comfort. And of course, if it is an unstable fracture that is going to need surgical fixation, that's a different story. But even after fusions, it's fused. So there's not really, oftentimes, TLSOs are not even ordered after spinal fusion. And then laminectomies as well. There's not really any spinal precautions after that either. Precautions, I can't talk today. There's not really many spinal precautions after that either. So each doctor is going to be a little bit different, but just looking at the current evidence, again, from the past 4 years, is leaning towards not really needing it. There is some other discussion on non-traumatic or atraumatic fractures in people who are osteoporotic, where back braces might be a little bit more helpful in these folks. But again, the jury's kind of out on that as well. So hope that's helpful. If you are wondering if you need to continue to wear it or not, again, check with your doctor. I am only letting you know what I have seen in the evidence, and I will put the notes, or I'll put the links in the description below so you can read it for yourself. And then you can ask questions to your doctor, and they might say, yeah, no worries, don't wear it. Or they might have specific examples of like, no, for this particular fracture, you're gonna wanna keep wearing this. So anyways, hope that is helpful. See you on the next one.